Welcome to HIMS TV. My name is Dylan Yogendra. I'm the managing editor at HIMS EMEA. Today, it's fantastic to have Bart De Witte with me. Bart, can you give us a little overview of what your background and role is currently, please?
Yeah, hi Dylan. Happy to be here, digital, online. So I've been 20 years in the digitalization field of healthcare, working for larger corporates such as SAP and IBM, at the beginning focusing on ERP in the hospital, but as we kind of matured, we started to digitize clinical data, and as we know now there is so much data, so my main focus is what do we do with that data, and my main focus area is of course artificial intelligence.
And so you just touched on the fact that you've recently left IBM to follow a new mission. Can you briefly explain what you're trying to build, please, Bart?
Yes, so I've been very deeply involved in a lot of AI activities, not only within IBM, I mentor startups, and I have this deep concern about Europe's capability to be competitive. And I believe that we need to define our own set of rules and frameworks in Europe, and I don't believe that politicians will be able to create a framework. So I'm starting and I'm setting up an NGO that is focusing on creating something as similar for an open source movement to software, but open sourcing for AI. So SMEs, small and medium enterprises that are, or startups that are, which is what Europe is about. We don't have monopolists like in the US. We are kind of a federated region. So they can start using and applying these AI services, and they can share with other companies. So we get kind of the shared knowledge layer that is based on AI technology. So there is less competition on owning and centralizing the knowledge. So you get like information asymmetries, because I strongly believe that these information asymmetries will lead to higher health inequalities. So only when we break down these asymmetries, we can reach out on a level of equality in healthcare, which is very much connected to our European value system.
Absolutely. So just to kind of dive a little bit deeper into the health inequalities, what is it about data monetization that you think will lead to actually greater inequalities in the healthcare industry?
Yeah, so a lot of people are creating that narrative that data is the new oil, or it is a commodity. I think data is not a commodity. Data is, for me, something that we extract out of our bodies. So data is human life. Now we can ask ourselves our question: do we want to economize our bodies and make it part of economical system? And I as well opposed to that idea. If you put data equal to capital, that means that big capital will lead to big data. That means that big capital will lead to the best information. And in Europe, we are dependent from one single search engine that has 92% market share. These network effects and platform business models and AI services always lead to centralization. And we have to ask ourselves the question, do we want to allow somebody owning all the medical knowledge into one single tool where we have to pay? And I say, like, no, we can do this differently. So I look at data as being something that is a common good. So what we do with our NGO that we are building up is collecting donations. And with these donations, we create data commons that we then make available for public or open AI.
Talking of AI, how do you think we can open source the development of medical AI?
You need, that's not something that I do, that is something that the community does. And to create a community, you need kind of to have a joint vision, or create a joint purpose. And what we saw in during the COVID-19 crisis is that many open source movements started to collaborate with each other, or institutes, private organizations, public organizations started to share data. So which showed or demonstrated when we have a joint enemy, we collaborate. So COVID-19 was a joint enemy. Now we can ask ourselves the question, after COVID-19, what is going to be our joint enemy? And for me, this is health inequalities. That's an enemy for me. And I want to make it available to all. And I think if you give everybody access to that same level of information that saves your life, then you destroy health inequality. So you need to make it a common good that is available for other companies to even monetize. I have nothing against monetization, but I want competition. I want it to be shared. And sometimes I compare it with giving people free access to meat. And if everybody would get free access to meat or vegetables for the vegans, then we still will go to a restaurant and pay that restaurant to make it an experience, a product that we want to eat. But nobody will die of hunger. So it's kind of the similar thing. We can make something a common good, and companies can enrich that with services and experiences.
So Bart, can you tell us a little bit about how important you see the cultural piece of things and developing the right mindset to really understand and develop AI solutions moving forward, please?
Yeah, I think the mindset is the biggest challenge, because I talk about AI for the people, by the people, and of the people. So I'm a kind of a people organization that is funded by private donations. And if you then see the behavior of single individuals when they use free services on the internet, they don't understand these concepts. It is really easy to trick a client in, this is for free, but then you get all their data and you create a product out of that client. So I always say there is this Russian proverb, the only free cheese you will find in a mousetrap. And a lot of these things are a mousetrap. So we get something and then we have to pay back. So the mindset is about, first of all, education. Like, you need to, a lot of people still don't understand AI. They think it's like this magical tool. At the end, it's just a pattern recognition machine that is fed by data, and we need good data. And now we can do two things. We can pre-invest in data, or we can donate our data, and then we pay back for the knowledge that is extracted out of the data. And so there are two ways to do that. So I've learned that the physicians are absolutely supportive of my initiative, because physicians know that knowledge should be free. Since 300 years, since the Enlightenment, we learned that we need free access to knowledge, because that's what is improving society. With individuals and citizens, it will be a lot of work. We need a lot to invest in communications, in campaigning, and creating that mindset.
Absolutely. And I think what we've learned so far is actually this mindset is something that can't happen. The mindset change isn't something that can happen overnight. It's something that can take years. But I think you seem to be going in the right direction. I feel like COVID-19 has perhaps expedited this kind of, or accelerated this mindset and attitude change. So it sounds positive in that sense. Unfortunately, we're out of time now, Bart, but we thank you for your time.
Thank you.